Welcome back for another deep dive. This time, we're looking at something pretty important for, well, everyone who cares about animals, really, and that's the well-being of the amazing people who make up our veterinary teams.
Definitely a timely topic.
You actually send over this JAVMA viewpoint article that proposes using a national plan as like a
Yeah.
framework for making things better in veterinary medicine. The interesting thing is, this plan, it was originally designed for human healthcare workers.
It is, yeah. The article from JAVMA basically suggests we take the National Academy of Medicine's, names, National Plan for Health Workforce Well-being, and see if it works for veterinary professionals.
Makes you wonder though, like how well does a plan from human healthcare really translate over to veterinary medicine? I mean,
Right.
because burnout and compassion fatigue, we hear those phrases all the time, and it's not just in human healthcare, right?
No, not at all. Veterinary professionals, sadly, they face really, really high rates of burnout, depression, even suicidal ideation. It's a major problem. Like it's a critical issue that we got to address.
It's heavy stuff. So then this NAM plan, how's it aiming to handle this problem? What's the approach?
Well, it's not about these Band-Aid solutions, like it's not about just telling individuals to toughen up or be more resilient. The NAM plan, it's different. It's got this much broader focus. It really zeroes in on organizational and systemic change.
So it's like instead of putting the onus on the individual, it's saying, hey, let's look at the bigger picture and
Uh-huh.
create work environments that are actually supportive from the
Right.
get-go.
That's the core idea. Yep.
Okay, I like that. I like that approach.
Mhm.
So then what are the key elements of this plan? Like what's the breakdown?
So they actually outline 7 key priority areas. And the first one's really the foundation for everything else. It's all about creating positive work and learning environments.
Okay, that makes sense.
Yeah.
Like happy, healthy teams, they just do a better job, right?
Like,
Better care for the animals. But I guess the question is, like what does a positive work environment, like what does that even look like in a real, busy veterinary practice? Because those places they're hectic.
oh, totally. And the article actually pulls from the Merck Animal Health Veterinary Well-Being Study. And in that, they identify 4 key characteristics of what makes a healthy work environment.
Okay, lay 'em on me.
A strong sense of belonging.
Yeah.
Like people need to feel like they're part of the team.
Right.
And trust in the leadership and the
That's it.
organization. Open communication. Got to be able to talk to each other. Right? And this is a big one. Sufficient appointment time.
Okay, those all seem crucial, but I'm already getting hung up on that last one.
Yeah,
Sufficient appointment time. I mean, because that's got to be such a challenge, right?
it is.
Like balancing, like efficiency and quality care.
Mhm.
And that kind of leads into what is the next priority area then?
The next one is measurement and assessment. And they emphasize the need to go beyond just anecdotal evidence, actually measuring burnout and distress using validated tools.
So not just going with gut feelings, but actually gathering data so you can really see like how big is this problem? What kind of tools are we talking about here?
So they bring up the AVMA census of veterinarians, and that census, it has included questions about well-being, using the professional quality of life or ProQL
Yeah.
scale.
Okay, but I'm guessing that data it's mostly focused on the vets themselves, not the whole team.
Right, that's the burning question.
So
While the ADMA census, it's given us like really good insights into veterinarian well-being, we need more comprehensive data that includes all the members of the veterinary healthcare team.
yeah, everyone, the technicians, the assistants, the receptionists, the whole crew.
Everyone.
I bet getting that kind of data, it would take buy-in from the individual practices themselves, right? It's one
Yeah.
thing to recognize there's a problem, but it's another thing entirely to actually measure it. So then what's the next step in this plan?
The next priority area, it focuses on mental health support,
Mm.
and especially addressing the stigma that comes with seeking help.
Yeah, it's almost like there's this culture in healthcare, and veterinary medicine isn't immune to it. This culture that kind of makes people afraid to admit that they're struggling.
Like they should be superhuman or something, like immune to all the emotional stuff that comes with the job.
Yeah, exactly. And so the plan it stresses how important it is to make mental health services available, like readily available and accessible. And not just that, but like included in employee benefits packages.
Okay.
And here's the big thing. Using those services, it shouldn't lead to any negative repercussions. Right. Like no fear of judgment or like career setbacks,
Yeah.
for taking care of yourself, taking care of your mental well-being. Okay, that's a big step in the right direction. So what else? What else does this plan, what else does it tackle?
The next area, it's addressing compliance, regulatory, and policy barriers.
Oh, okay.
Yeah.
That sounds kind of bureaucratic. What kind of barriers what are we talking about specifically?
Well, one example they highlight is multi-state licensing and how complex it is.
Oh, yeah.
Because each state has its own set of requirements, right?
Mhm.
And that can create these huge obstacles for veterinarians who, they might want to practice in different states.
Yeah.
And that can really limit their professional opportunities.
Oh, it's like a headache you don't need.
Exactly. And it just adds to the overall stress of the job.
Totally. So what other barriers does the plan address?
Yeah. They also talk about reducing administrative burdens, all that stuff related to record keeping and reporting,
Oh,
so that veterinary professionals can, focus more on what really matters, patient care.
yeah. That sounds like a win-win for the veterinary team and of course for the animals that they're taking care of. What's next on the list?
Another important focus is engaging effective technology tools.
Okay. Technology in veterinary medicine. I'm thinking like advanced imaging or surgical equipment. Is that kind of what we're talking about here?
Well, while those advancements are obviously super important, this particular priority, it's more about health information technology.
Yeah.
It's making sure that technology is actually supporting veterinary professionals, not adding to their stress levels.
Okay, so like streamlining workflows, cutting down on administrative tasks, making sure those systems are actually user-friendly, all that good stuff.
Precisely. The plan also talks about managing excessive job demands, which often can get amplified by technology that's either poorly designed or implemented.
Excessive job demands.
Yeah.
That sounds like it kind of goes back to what we were talking about earlier with the sufficient appointment time.
It absolutely does. Absolutely. The plan, it really highlights how important it is to manage workloads effectively and prevent that cognitive overload that can just lead to burnout.
Yeah. It's about finding that balance where you can provide excellent care
Right.
without burning out the team in the process. What else is on the list?
The next one is institutionalizing well-being as a long-term value within the veterinary profession.
So not just making it a passing trend, but really embedding it into the very culture of veterinary medicine.
That's the crux of the matter. The article emphasizes that we need to learn from what happened during the COVID-19 pandemic, because it really exposed how fragile our healthcare systems are, and it really underscored the importance of prioritizing well-being.
Yeah. The pandemic, it was definitely a wake-up call. Like we can't just keep pushing people to their limits without there being consequences.
Yeah.
Right? What's the final priority area?
The last one is recruiting and retaining a diverse and inclusive workforce.
Diversity and inclusion. Those are big conversations happening across a lot of industries these days, not just in healthcare. How does that apply to veterinary medicine?
It's about recognizing that a more diverse and inclusive profession, it's a stronger profession and a more resilient one. And it's not just about representation. It's about bringing in diverse perspectives, lived experiences, and different approaches to problem solving.
So it's like widening the pool of talent and fostering like a more welcoming and inclusive environment for everyone. So what kinds of diversity are we talking about specifically here?
It's not just about racial and ethnic diversity. It includes things like gender identity, sexual orientation, socioeconomic background, neurodiversity, disability, age, the whole spectrum.
Okay, yeah. That's a pretty comprehensive view of diversity. It's really about creating a profession where everyone feels seen, heard, and valued. What does that mean then for veterinary teams? Like, what are the implications?
Well, studies have shown that diverse teams, they're more effective communicators, they're better problem solvers. And that's especially important in veterinary medicine, where you got to be able to communicate effectively with clients and with your colleagues.
Right, right. A wider range of perspectives just leads to better outcomes for everyone, for the animals, for the clients, for the team. Okay, so this plan was originally designed for human healthcare. Are there any unique challenges in veterinary medicine that we need to think about?
Absolutely. Well, the NAM plan, it gives us a really good, like a valuable framework. We gotta remember the specific challenges that veterinary professionals face.
Okay, what kind of challenges are we talking about here?
Well, for one thing, veterinary professionals, they often have to deal with really intense client emotions.
Oh, for sure.
Especially when you're talking about the health and well-being of their beloved pets.
Yeah, that's understandable. People get very attached to their animals, and those conversations they can get pretty emotionally charged.
Exactly. And then you've got the ethical dilemmas that are really unique to animal care. Issues that human healthcare workers, they don't typically encounter.
Yeah, like end-of-life decisions.
Yeah.
Or dealing with cases of animal abuse or neglect. That stuff, it can really take a toll.
Precisely. So while the NAM plan is a fantastic starting point, it needs to be tweaked a little bit to fit the context of veterinary medicine.
Okay, so we've kind of unpacked these seven priority areas from the NAM plan, and we've talked about some of the unique challenges that are specific to veterinary medicine. What's the takeaway message here? Like, what's the call to action?
I think the biggest takeaway here is that if we want to address occupational well-being in veterinary medicine, it can't just be about individual resilience. You know what I mean?
Yep.
It's got to be. It takes a collective effort from everybody involved to create a system that's more supportive and sustainable.
So it's not just like, toughen up. You're a vet. You're a technician. Just deal with it. It's more about creating this culture of well-being at every level.
That's exactly it. Academic institutions, accreditation bodies, professional organizations, practice owners, even clients, like everybody has a role to play in making this profession healthier and more sustainable for the people who are in it.
I'm definitely hearing a theme here. Like it's not about pointing fingers. It's about shared responsibility. Now, this JVMA article, it throws out the NAM plan as this framework. Does it offer any concrete solutions, though, like for addressing well-being in veterinary medicine?
The article, it's more focused on presenting the NAM plan as this roadmap for change, not a set of specific solutions. It's more about, shining a light on the areas that we really need to focus on, but the actual strategies, those are going to have to be, tailored to each veterinary practice and each organization.
So it's less about giving everyone a step-by-step guide and more about starting a conversation and inspiring action.
That's a perfect way to put it. Yeah. This article, it's a call to action for the entire profession to really take a look in the mirror and start making real changes.
This has been a really fascinating deep dive into a topic that honestly it doesn't get enough attention. So what's the one thing that you hope our listener takes away from this?
The main thing I hope people understand is that the well-being of veterinary teams, it's totally connected to the health of the whole profession. Like when we prioritize well-being, we're not just supporting the individuals who are taking care of our animals. We're also creating a veterinary workforce that's going to be around for the long haul.
And to our listener, I'd add this: think about what you can do in your own little corner of the world, to help make the veterinary profession a more positive and supportive place. It doesn't matter if you're a vet, a technician, a practice owner, even a pet parent. We all have a part to play.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.